we utilize phospholipid therapy in the clinic, and I know lots of practices do. You do. And we use, Patricia Kane protocol, PK protocol, and others that are quite common. Can you go into that for someone listening and saying, I've never heard of phospholipid therapy, and these compounds you're talking about? What are they actually doing? What are we doing when we use phospholipid therapy?
Patricia Kane is the queen of phospholipids, and what she actually brought out to the modern medicine at this point in time. I had a history of heart attack when I was 33 years old. And the root cause issue was dealing with hidden Bartonella, mold toxins, and Epstein-Barr and parasitic and heavy metals. Yeah. And during that point of time, in a crisis, basically trying to find a root cause, my doctor was, very savvy enough and smart enough to order the fatty acid panel testing and then send that results to Dr. Patricia Kane. She was the one who really directed in terms of utilizing phospholipids to save my life. So, that's when you mentioned Patricia Kane, she's kind of been out of the circle these days because obviously she has her personal things going on, but I have to really give it to her that she saved my life. Really. I mean, if it wasn't for her and over her guidance in terms of what type of phospholipid therapy that I needed at that point in time, I don't think I would be alive right now. And especially I had severe mold toxic issue, which caused vascular inflammation on top of the hidden Bartonella infection. Bartonella in general, yes, is a tick-borne related illness, but it can actually cause endothelial damage. So that's a perfect scenario for mold and Bartonella to cause a 85% blockage in my LAD. That's what happened to me. So I have a stent put in right now, and that was 2015. I'm Bartonella free and obviously went through my own healing journey as well. But that's something that I preach about because it saved my life. I know it's going to be a great potential things that patients could utilize to get themselves better. So kind of going back to your question about why this is so important and what to use, I recommend using BodyBio PC and their fatty acid line of supplements they're utilizing, because that was basically designed by Dr. Patricia Kane and Dr. Ed Kane as well. Years ago, they used to do a lot of training, but obviously they're not doing that anymore. But that was basically the pinnacle of what the overall phospholipid is. And they used and is still utilizing some of the proprietary liposomal formulation of the full phospholipid complex. So I mentioned about 4 different complexes of phospholipids. So phosphocholine, phosphoethanolamine, phosphoinositol, and phosphoserine. Those are 4 different types of the outer membrane, if you want to call it, within the cell. And then the inner portion of the cell membrane, I like to use BodyBio's balanced oil, using a 4:1 ratio of omega-6 and omega-3. That was touted by the World Health Organization to actually have the best balance of omega fatty acid that people be needing. And that makes a lot of sense. And as well as the fact that the unadulterated linoleic acid the cell membrane really needs as a building block in the interior of the cell, that's one of the things that I end up having to use to help start to calm that cell danger response that the mitochondria is going through. And then I also like to utilize the sodium butyrate from BodyBio. So utilizing that as a combination of it. So everybody thinks that butyrate is something that your gut produces from the bifidobacter, which is true, right? You need the sodium butyrate and the butyric acid to help to deal with the leaky gut issues and integrate the gut. But the butyrate does a lot more than that. It actually helps to protect the DNA, helps to stabilize the cell membrane. It also helps to increase, and as a neuroprotection going on as well, as an increased levels of neuroprotective activity. So it could be very helpful for a patient dealing with TBI, traumatic brain injuries. So there's many things that these type of a naturally occurring fatty acid that our body produces and utilizes. Well, these are key things that I end up having to add in to do that. So anyone not knowing about what they need to do in dealing with some of the chronic issues, they feel stuck, well, start to incorporate phospholipid therapy into your overall protocol. And you got to start very slow. Your cell starts to fix things around. It starts to really help to increase the detox pathway, and patients might get sick, or I call it the Herx reaction. So starting out very, very slowly and increasing their doses and result in the fact that your cell membrane starts to fix itself, that's where the overall full healing that occurs. And I like to call that as a resiliency, the cell resiliency the patient be needing, because you don't want to go through a constant amount of use of binders or these supplements. You want to build up the resiliency that you need. So this way, even in a tough scenario of having to get reintroduced to a particular toxin later on, your body's resilient enough to fight through it very easily. And that's something that I learned on myself, going through my own healing journey, as well as something that I end up having to teach and take care of my patients as such.
An amazing healing journey yourself. I didn't know that story, and that's always impactful when you yourself become the patient, have to heal yourself, and then you could pay it forward by helping others.